We are right now at the AHA Scientific Sessions 2017 in Anaheim, California. I'm here representing UT Southwestern in a number of endeavors. I have 3 presentations where I'll be talking about different aspects of valvular heart disease. One of the sessions that I'm at tomorrow, I'm going to be talking about the different patient indications and a clinical experience with TAVR. Right now, there is a multi-society endeavor to really update which hospitals and which operators should be doing TAVR. So really providing a blueprint for how TAVR is done in the country and will be done in the next few years. We've really focused not only on the volumes, but also on very carefully on the quality metrics. And I really think it is one of the first of its kind where we're taking a technology that is rapidly expanding, but then really focusing on the quality aspects and trying to make sure that as we roll this out, we can maintain quality in the U.S. But in general, I think it's a very exciting time for TAVR, and the biggest thing is I think it's really set the benchmark for future technologies, not just in the valvular heart disease space, but for cardiology in general. I think the takeaway is that if you have a patient with aortic stenosis that you feel should have a discussion about advanced therapies, whether that's surgery or TAVR, that you should really understand how the hospitals that you refer to, how they do for these procedures, how they select patients for these procedures, and so that all patients can have the best outcomes no matter which procedure they actually end up undergoing.